welcome to your weekly Medical Town Hall. If you are tuning in for the very first time, I am your Medical Group Commander, Gwendolyn Foster, and with me I have our Public Health Officer, Captain Lankard, our Pediatrician, Captain Aqualia, and my right-hand woman, Chief Bradley. And as always, you see that number flashing across your screen, so please, we want to get to your questions. So please start sending us those, so as we're giving you that much needed information, we can start getting those questions to be able to answer afterwards. And with that, I'm going to turn it over to Captain Lankard with the current situation. Captain Lankard.
Awesome. Good afternoon, everybody. So these are going to be your dashboard slides for the week. They changed up very slightly with a couple new updates since California is starting to see itself reopen a little bit. Most importantly, the COVID symptoms have been adjusted. There's no 1+2 anymore. It's just if you have any of these symptoms that are listed up there, such as sore throat, muscle pains, new loss of taste or smell, which is a really interesting one, those are the potential symptoms now. So make sure you call your provider for an evaluation, whether you're civilian, live on base, any of that. In the bottom left-hand corner, you'll see the current picture for the United States. It's still spreading around pretty much everywhere. There's a lot more states now that have high transmission, high spread, high cases. Even though generally we're starting to see new cases go down a little bit, it's still incredibly widespread. In the top right corner, some of the updates is LA County stay-at-home order is expected to last at least 3 more months, though it's going to have some gradual relaxations with it, which is what you'll see reflected on base and across the rest of the nation as well. As of today, 18 counties in California are now being approved to move to the expanded stage 2 of reopening, which you'll see on the next slide as well. And social distancing and hand hygiene, as you heard me say pretty much every single week, is still the #1 way to prevent a COVID infection. And in the bottom right-hand corner, that's a change from last week across the United States. We've increased tremendously with cases, and deaths are now over 80,000. So next slide, please. So this is just going to be your overall site picture. So the top left graph is different. It's just kind of what the outbreak looks like around the Edwards Air Force Base proper since the beginning of the outbreak around mid-March till now. So you can see there's been a bunch of different spikes. That main one was because of the reporting changes. There was a backlog of test results, which I've briefed on before. Bottom left-hand corner just shows you the change. Palmdale, Lancaster is still going up. LA is going up. Cal City hasn't had any new cases. Neither has Roseman. And Tehachapi has just had 1 slight increase. So the chart on the right is what you're going to hear about a lot in the news as far as California's reopening plan. So this is what's going to be applied to all the different counties across the state. You can see stage 1, stage 2, stage 3, and stage 4. Stage 4 is basically the end game when COVID pretty much is a return to normal type ops. So you'll see different things starting to relax depending on what their plans are, what type of business they are, and this is kind of what's being used as a guide. You can go to the Public Health, California Department of Public Health website if you really want to reference this for yourself, but this is what you'll kind of start hearing, and it'll be based off of this and approval from higher headquarters too, as in the California state government. But overall, this is pretty much your site picture. COVID's still around. It's pretty much going to be here to stay for quite some time. And continue just keeping yourself and your family safe by doing that good hand hygiene, social distancing, even as things open up, because we can do this in a very safe way. It's just certain rules have to be followed. That's it.
Thank you, Captain Lankard. And with this slide, I know you see it every week, but it's very important to us that you know what services are available to you. So while we're still in HPCON Charlie, we still have some degraded services, but as we start to reopen and go through those stages, you will still start seeing more services turn green as we bring them more online. Also, we continue to work with our local community partners as far as making sure that the care you need is available in the community. They continue to have that increased bed capability as well as low numbers when it comes to our COVID-related patients. Also, with our community partners, we're making sure that those specialty care services are also available to you when you need it. And with that, I'm going to turn it over to Captain Aqualia so she can talk about our pediatric services. Captain Aqualia. Oh, I take that back. So as you are making that appointment, please use that portal, that TRICAREonline.com. So whether it's a virtual appointment or face-to-face, that is available to you. And as always, if you think you may have been exposed to COVID, we want you to use that appointment line so that way we can make sure that you get the care that you need in that situation. And now with that, I'm going to turn it over to Captain Aqualia, who's going to talk about our pediatric services.
Awesome. Thank you, Colonel Foster. So Like Captain Lankard and Colonel Foster mentioned, that we in pediatrics are balancing everything that we know with coronavirus and all the new information that we get every day with the general needs that you've always had, getting your well checks done, getting your sports physicals done, getting your referrals done. So a little bit about what we're doing currently in pediatrics in HPCON Charlie. So we're still seeing well child visits for all of our kiddos 2 years and younger. And by seeing, they all start as a virtual. So for those newborns all the way up until 4 months of age, we expect that the day of your appointment, we're going to first get on the phone with you, do the virtual, get the history, talk about development, all the counseling, and then bring you in that same day for your face-to-face portion to do your measurements and then get vaccines done as well if you're in that age range that needs vaccines. All other kiddos, seen 6 months, 9 months, et cetera, until the 24-month, you'll get your virtual phone conversation, do the same thing over the phone, and then if there's something in the story that needs a face-to-face, we'll bring you in that same day. Otherwise, we'll leave it at the phone conversation and we'll see you at the next visit. So with that being said, there's a little bit of coordination to be done with the vaccine clinic, immunization clinic. So we're doing vaccines for our 2-month-olds, 4-month-olds, and 12-month-olds. The reasons why we picked those particular months and we're skipping the 6-month, the 15, and the 18 is because the 2, 4, and 6, for the most part, are all the exact same vaccinations. After you've gotten 2 rounds of that, you have a pretty decent immunity that the social distancing, the stay-at-home orders will take care of the rest. You're not being accidentally exposed at the supermarket, at daycare, in the same way that you were previous to these social distancing measures. The 12-month-old, we're adding those in because that age has a brand new vaccine, specifically the measles, mumps, rubella, and the varicella vaccine. So even though we're social distancing, we want to make sure that your kiddos are protected when it comes back, when life goes back to the new normal, when we're out and about in the general public. The exception to that is going to be your kiddos that are still in daycare, still at the CDC, because we want to make sure that they're still eligible and able to go, and we'll still book them in. But all immunizations, no matter what you're getting it done for, whether it be our pediatrics or adult, active duty, dependent, whatever the case, is by appointment only. So that way that our waiting rooms aren't packed and your risk of exposure while you're here at our med group is kept to a minimal. The other big thing with well visits is that labs are done at the 1-year mark. So those labs, again, are recommended, required. We're screening for anemia and lead level specifically. So we want to coordinate your vaccine appointment with the lab order. So if you're calling in through the appointment line and making that appointment for immunizations, also be sure to ask and make your 1-year checkup. So that way we can have that lab order put into the system. So the day that you come for your vaccines, you can also get your labs taken care of without an extra visit. Next slide. The other big thing I know that's been on everyone's mind has been school forms, sports forms. So we're still filling out paperwork. So if you've had a well child visit within the last 12 months, we should be able to fill out whatever forms you need. There might be some questions that weren't asked at the last well visit, in which case myself, Dr. Singh-Miller, or whichever other provider that's doing your forms will set up a phone conversation appointment to ask those clarifying questions so that way we can get the forms done. If you haven't been seen in the last 12 months, then unfortunately we won't be able to fill out the forms, but we have spoken to the local school districts and they're more than willing to register your child without the exam and without the medical portion completed, but with the understanding that eventually we'll get that done and submit it to them before the school year starts. And that'll be a lot of coordination with the local public health departments, with the base public health departments to see what's going on with the school district and what needs do we have. The other big question is sports forms. Yes, in theory, if we've had a physical in the last year, we can fill out your paperwork, but sports really aren't starting anytime soon, so those could wait. But we can, again, fill them out if you have an up-to-date physical.
Thank you, Captain Aqualia. Next slide. And so as always, we cannot do this without you, so continue to do those precautions. Wash your hands, cover your cough, wear your mask, do that physical distancing, and if you have any questions about the care, about your care or what care you need, or if it's COVID related or non-COVID related, please, you can call our appointment line and we are here for you. And with that, I'm going to turn it over to Chief for any questions that you may have.
Good afternoon. Once again, for those who are just tuning in, I'd like to explain who we have on our panel today. We have Colonel Gwendolyn Foster, our medical group commander. We have Captain Erin Lankard. She's our public health officer. And we have Captain Dr. Aqualia, our pediatrician. So please send those questions in. You can either comment live on our Facebook page, or you can also text your questions in to the number you see on our screen. We had one good question come in, could go either public health or pediatrician way, and it's how much risk is it for kids to go to the CDC or school?
Want me to take it? Do you want to take it, Captain Qualia?
So let's talk CDC and daycare right now. So the risk of going to CDC, the risk of going to daycare if you're going off base, is not any higher than the general day. At daycare on any given day, you got flu, you got strep, you got hand, foot, mouth, you got so many different viruses and bacteria going around that currently in a global pandemic, the CDC is not only taking, and any daycare is not only taking the general precautions that they're taking to reduce the risk of kids passing germs between each other, but even more precautions now that we're in a global pandemic under the guidance of our public health department and local rules and regulations that are coming down from the federal and state level as well. And Captain Lankard, if you want to expand.
Yeah, so just to kind of expand on that. So absolutely what you said was correct. The CDC, you don't have a higher risk of sending your child to the CDC right now as you would off base, on base, any of that. So right now, the CDCs have taken expanded precautions because of COVID. So that's why there are less kids in the CDC, which makes less transmission possible just in case. They're practicing a lot of great hand hygiene there. The toys are being cleaned extensively. They already were, but now there's so much more attention on it, which is why you see the class sizes being decreased, which is why you see different drop-off pickup procedures and things of that nature. So overall, there is no increased risk for having your child at school or at the CDC at this time.
Thank you. We have another question. If they release the stay-at-home order, how safe is it to fly across the country? Captain Lankard?
That is an excellent question, and that's becoming more and more relevant. So right now, it depends on what releasing the stay-at-home order means, because there's different ways that the stay-at-home order is currently being applied. Just like I said in my slideshow, there's different levels to it. So if you wanted to fly across the country, there are some considerations depending on what else is going on in the country to kind of keep in mind. This is kind of the theme across what we've always said. So depending on what other states are doing, depending on disease transmission, all that good stuff, if we start to see a resurgence of COVID-type cases, or even now, while COVID is still circulating pretty heavily in the United States, there is going to be a risk to fly across the country. The risk from that activity isn't necessarily from going through the airport, though, depending on how many people are in there. That's obviously a potential exposure. If you're hanging out in the airport, same thing. It's the same thing when Wuhan was the hotbed and people were really concerned about flying through international airports. So if I was to fly across the country, it'd depend on what state am I going to, what procedures are in place at the airport to encourage social distancing, to make sure people aren't gathering together, because we all know how, especially LAX, how crazy that place can pretty much get and usually stays. So depending on those procedures at the airport, and depending on what they're doing on the actual airplanes, because a lot of the companies were originally supposed to be doing social distancing on the plane. That being said, you're still on a plane with a bunch of other people for hours and hours at a time, so obviously that's going to increase your potential case of exposure, or potential for exposure. So again, a lot of it is going to be, you want to avoid those groups of people. If you don't have to fly, at least until COVID basically calms down, it'd be a good advice. But if you do choose to fly, obviously practice that social distancing as much as possible, hand hygiene, and then wear your mask, and then follow whatever the airline's procedures are. Because right now that's something that's being looked at pretty highly on a federal level, to be like, how do we redo this while this disease is still basically in our midst? And then whenever you reach your destination, obviously follow the strictest procedures that are there as well, because even if the stay-at-home order gets released, if COVID's still around, COVID doesn't care, essentially. If you have a stay-at-home order, if you don't, you still got to take that responsibility to protect yourself and your family as best you can, and that's by using those steps that I already described.
Thank you, Captain Lankard. We got one question in. Do you know when the CDC will be open to more children? The short answer is no, we don't know that, but I would direct you to our Force Support Squadron. What I can tell you is that all units on base are looking at how to phase back to full capacity. So all units are kind of going through that planning process now, but talk to Force Support specifically for that question. All right. Speaking of sports physicals, how do I get my sports physical paperwork to the clinic? Can I drop that off, or does it have to be emailed in?
So you have a couple of options to get those sports forms to us. One, if you can drop it off physically, and the ECP points or our checkpoint when you drive up to the med group, you can drop it off over there. They will be collecting forms that it's not only for peds, but even for our adult medicine side of the world, women's health side of the world. Any forms that you need completed, as long as that top portion is filled with 2 patient identifiers, so at the minimum, the patient's name and birthday, but as much information, phone numbers, things of that sort. Drop it off, they'll collect it through the course of the day, and at the end of the day, bring it into the building. So the next morning, in theory, is when I would receive it to take a look at it and then fill it out. The other option is through the TRICARE online portal and the MyCare messaging system. That's a secure way to send in your personal information, and you can upload a PDF and send it to us that way as well. And then as far as pickup, we can send it back to you through the MyCare online portal. We can have it ready for you to be picked up at the med group as the hard copy. And then we're looking into some other options like secure emails and things of that sort, but more to come on that. But currently, those are our 2 options.
Thank you, ma'am. All right. We got a question earlier. How do I still work my referrals? And there's 2 answers right now. One is you can call HealthNet Federal Services or TRICARE West directly. That number is 844-866-9378, and we'll be sure to post that after this. Also, you can call our appointment line at 661-277-7118, option 4, then option 2, and that will get you to our referral network contractors. They are still processing things. Just know that right now we are having an issue with our telephone system, so you may encounter a full voicemail box. They're trying to work through that, but as soon, just know to keep trying. Okay, keep sending those questions in. We have one more for Captain Lankard. Are COVID patients on base tracked as part of Kern County?
So that's another good question. So the tracking, it all depends. So it depends on where the individual is tested at, and usually it's that lab that reports it. So if someone was a positive on base, in the sense of our lab is the one that tested it, then yes, so we are the public health, essentially, authority for Edwards Air Force Base. So we would both report that to the state, to the county, and then we also have our own internal DOD reporting mechanism that we do for all these other reportable diseases, certain STIs, different infections, stuff like that we already utilize. So it's absolutely ingrained in that. So short of it is if you are tested on base and you come up positive from our on-base lab, you will be reported to Kern County. If you get tested in Kern County, you'll be reported to Kern County. Some cases, if you get tested in LA, you'll be usually reported by LA County. So that's kind of how, whether or not you live on base or whatnot. And then also some labs kind of do their own thing sometimes where they'll go by residency, but usually it's wherever your sample was collected and you were tested at, that's who will report, whether or not you live on Edwards or you could live in Tehachapi, but then you get tested in LA. LA usually will be the ones that report you that way.
Thank you, ma'am. We've got a question. When will face-to-face overseas clearances for dependents start back up in the clinic? And Colonel Foster, are you able to answer that one?
I know we're starting to look at, all our services, bringing them online. So right now, I would say you call that appointment line, and as much as they can do virtually, they will. And for those needed face-to-face, we also have a process in that. So we are still providing that face-to-face care, but we want to make sure that it is needed before we bring you into the building to keep that risk to a minimum.
Thank you, ma'am. Was there anything else?
Yes, actually today we got an update through our EFMP program and AFPC regarding overseas clearance, that AFPC is actually recommending we hold overseas clearance paperwork and physicals and face-to-face until June 30th to align with that STOP movement. But if you do have an order to go sooner than that, case-by-case scenario, we can accommodate and do those face-to-faces. But if you have a request, I would recommend calling in through the appointment line, leaving a message that you, with your PCM, that you need this paperwork done, and depending on your scenario, we'll get it accomplished. But AFPC is recommending that overseas clearance face-to-face, that require face-to-face, just hold off until June 30th.
Thank you very much. Okay. So we're having a quiet time with some questions. Just be sure to text those in here within the next few minutes if you have a question you want answered regarding your medical care here at the center of the aerospace testing universe. I did get a comment here that I'd really like to share because it really goes out to the incredible job that our medics have been trying to do to take care of you and your families. It just says, I wanted to say thank you for the amazing job the Med Group is doing. I have recently interacted with my PCM, his team, as well as the pharmacy. Everyone was extremely helpful and my experiences were positive. Thank you. So thank you very much for giving us that positive feedback. We are here for any feedback you may have, whether it's positive, whether it's something we can improve on. Just share that with us, whether it's through our Facebook page, direct messaging, or this Text Me Now. And with that, are there any other questions or anything that anybody would like to address while we wait for some more questions to come in?
Well, I just want to pile on a little bit with what Captain Coelho said as far as with the out-processing paperwork. So we do know that some families are moving, even though during these stop moment times, there are priorities that are saying, no, you are still moving. So anything that has to do with out processing, call that appointment line and we will direct you to the right department. So we know that when a family is out processing, that crosses multiple medical services. So with immunizations, with dental, with family health, with pediatrics. So again, call that appointment line and we will make sure that you get what you need so you can report to your next duty station on time.
Thank you, Colonel Foster. We did have another question come in. The individual says, not sure if this was answered, but it's in regards to immunizations. When can my 18-month-old and 4-year-old get their immunizations?
Sure. So based on the current processes that we had as we were going from HPCON 0 up to Bravo, now to Charlie, the 18-month immunization, so in general, all immunizations for kids less than 2, is probably going to be when we get back to Bravo Plus, because that's what was happening on our way up to Charlie. The 4-year-old immunizations, when we're on the way down, will be our next set of priorities. So right now we're trying to handle everything for our 2-year-olds and younger. Our next set of priorities, once it's safe to do so, will be all of those kids that have immunizations due. So not only your 4-year-old, but also your 11-year-olds out there, your 16-year-olds out there that are going to get immunizations due at that age group, and then those that need school physicals. So after it's safe to do so, those are going to be our next 2 priorities. Kids with immunizations due, and those that need school entrance forms filled out that we weren't able to do during this time in Charlie.
Thank you, ma'am. Okay, right now we don't have any questions in. Colonel Foster, over to you. Oh, hold on, there's one more. If I'm retiring or PCSing, how do I out-process the medical group? And that is a great question. I'll go ahead and address that one. So look at your virtual out-processing checklist first. So when you log into VMPF, you've got that out processing checklist. We've made sure to include a lot of extra numbers on there recently to make sure you can get a hold of the clinic you need. But those sections are listed along with their contact numbers, since some of them may not be physically in-house. You know, you can't just stop by our clinic and walk through anymore. Without an actual physical appointment. So the first thing to do is contact them via phone. Some of those clinics have an email listed, so contact them that way. If you're retiring and you're within that 180 days out point, you can go ahead and go on to My IMR, and you can start your separation health physical exam portion online through My IMR. And any questions, feel free to call our appointment line as a good starting point, 661-277-7118. All right, Colonel Foster.
All right, with that, thank you again for tuning in to your weekly medical town hall here at Takata 2, the center of the aerospace testing universe. And we look forward to you tuning in next week. And we have a big surprise for you next week. So we hope that you tune in. And with that, thank you all.